Hello all, this is Brent Horton. I'm a student at Cal Baptist University, class KIN353, and today I'd like to go over some of the common injuries seen in running activities, so among athletes. So the first one that's commonly seen is called medial tibial stress syndrome. Most of you probably know it as shin splints, and this is very common among running athletes. In fact, according to the Principles of Athletic Training textbook, it says that it accounts for as much as 15% of all running-related injuries. But it also is very common among jumping athletes as well. So a lot of the track and field athletes are experiencing this. Excuse me. So the pain is generally felt on the anterior medial aspect or border of the tibia. So here's the tibia bone, the fibula on the lateral side. So the pain is typically experienced on the distal 2/3 of the anterior medial aspect of the tibia, although it is upon palpation, which I'll show you later in a test, the pain is also experienced on the posterior medial aspect as well. So what is MTSS? So it's basically inflammation of the periosteum of the tibia, or perioditis, and it's caused by the plantar flexors, specifically the soleus of the lower leg, to pull on the tibia, and this can cause microfractures, or rather micro tears, I should say, to occur at the tibia, which starts to pull on that periosteum that causes inflammation. So some of the common causes that we see typically with shin splints is oversupination of the feet. So it is also common in overpronation as well, but I guess studies have mainly shown that oversupination is more common. And we also see that improper footwear for the athlete, or the shoes just generally being worn out, is a big cause as well. And a tight heel cord, which is the Achilles tendon, and the muscles that obviously attach, which are the gastrocnemius and the soleus. Those muscles tend to be really tight among athletes, running athletes, and can cause the shin splints to worsen. We also see problems with malalignment, so hip to ankle, basically joint by joint approach. So if we have problems, obviously at the shin, what's causing the muscle, usually generally the muscles right above or below. And we also see any abrupt changes in the running program, so an athlete trying to do too much too soon, or any kind of abrupt changes in the running surfaces as well, so from going from grass to asphalt, for instance. That can bring on medial tibial stress syndrome as well. So how do we diagnose this? First of all, just a little anatomy. I think we already kind of discussed that, but the muscles involved are the posterior tibialis, flexor digitorum longus, and specifically the soleus. And the bone is the tibia, anterior, medial, and posterior aspects. One particular important thing to distinguish when testing for this is to find out if it's a stress fracture or MTSS. So really, to do that, if the pain is felt along the tibia is greater than 5 centimeters, chances are pretty good that the pain is associated with MTSS. However, if the pain is less than 5 centimeters, and is more localized, chances are it could be a stress fracture, but the only way to rule that out is through an x-ray. You can also do heel tapping, which could basically send a shock or reverberate the bone, so the patient would feel, if it is a stress fracture, would feel that bone a lot more than the MTSS. So when palpating, like I mentioned earlier, the pain can also be felt posteriorly. So as you can see, the tester is reaching really deep behind the tibia, and is really searching along that tibial border to see if there is that pain that they can replicate, which will indicate the MTSS. It's also important to assess for any biomechanical imbalances, so any muscular imbalances. So maybe a proper squat analysis to check for feet pronation, supination, or just simply standing anatomically and assessing for that. Okay, the next one that's very common is patellofemoral pain, which is really just a broad general term to explain pain that is generally felt at the patella knee joint area. And the muscles we have involved here are the anterior muscles of the knee, which would be the quadriceps mainly. So we got the rectus femoris in the center here, the VMO, vastus medialis, and the vastus lateralis muscles, and we also have the associated IT band on the lateral aspect, and further up towards the hip we have muscles that also affect this pain. So it's also commonly referred to as runner's knee or jumper's knee, and the basically it's the pain that is that's being caused here is usually because of a lateral translation of the patella, or a lateral tracking or movement of the patella. So it doesn't usually occur medially, but it usually occurs laterally, and this is usually due to once again a muscular imbalance, typically weak VMO coupled with a stronger vastus lateralis and IT band, which we'll kind of go over later. Now, chondromalacia, which is typically what it's also referred to as, this is what it can turn into if not taken care of right away. And chondromalacia is basically a softening basically of the cartilage that of the surfaces behind the actual patella and the condyles of the femur, and this can also lead to osteoarthritis if not properly addressed right away. But the only way to really assess chondromalacia is an X-ray. And then crepitus. So typically, along with that pain that they associate with patellofemoral pain, it's a general cracking or crepitus that goes along with that pain. Okay, so kind of taking a closer look at, like we were talking about earlier, so that the patella, should sit in the patellar groove or the trochlear groove, and like I said, typically what happens is we have a shifting laterally of the patella, so it starts to move laterally, which causes the pain, and it's due to muscular imbalances on the anterior thigh. So a joint by joint approach, of course, looking at above and below that problem area to see what's causing the problems. And as we discussed earlier, usually it's a weak VMO, overactive vastus lateralis, tight ITB, and weak abductors, and it could also be a tight or weak adductors. But an assessment would be most appropriate to distinguish which muscles are causing the problems. And kind of we already discussed these, but here's just kind of a picture of showing all the different things. Here's a picture of a guy with a lot of different problems, which, as you can imagine, can cause some really bad distortions and future problems muscularly, and eventually cause knee pain and so forth. But just to summarize, so changes in footwear would be a big issue. So really, if someone has pronation, they're wearing a shoe that's more suitable for a supinated foot. That they should be having a more structurally sound shoe, and they have a soft shoe that could cause some real problems. Some muscular imbalances we talked about, abrupt changes in surfaces, so from soft to hard or hard to soft, overload or overuse. So we have athletes that are not periodizing their training, so they're going too hard too soon. Shortening of the hamstrings has also been a cause, studies have shown. It can also be congenital, so oftentimes it could be just that someone has a big patella in relation to the trochlear groove, and so if it's not sitting in there properly, naturally that's going to cause some problems and pain. Or it could be, typically it's seen more in women, and that's because of the Q angle. So that could also be a congenital thing. Weak quadriceps, so as we discussed, weak VMO tends to be the problem, among other things. And foot overpronation is a biggie. Okay, so some of the tests that could be done associated with this patellar femoral pain is one of the most famous is the patellar grind test, or also known as the Clark's test. And as you can see here, the tester is performing it here, and it's basically just applying pressure just above the patella while you're having the patient extend and flex the anterior thigh muscles, and to see if there's any pain associated with that movement. And typically it'll test positive if they do have patellofemoral pain. They will experience pain. And the eccentric step-down test, so generally people with patellofemoral pain, they experience pain going up and down stairs, or up and down steps, but typically the pain is more associated with stepping down from steps or stairs. So this would be a good test to indicate that. And as we kind of discussed earlier, palpation. So generally, if a tester would just feel around there, and crepitation is also a good marker for that. One leg squat test. So this would be a good test as well if the person is capable of doing it. But more importantly, this would be a good test to see what muscular imbalances are going on. For instance, you might have upon descent, lowering down, you could see one hip that might be lowering on the leg that has the load. That could indicate weak abductors in the hip. You could also see lateral tracking of the knee, and it can also indicate valgus of the knee, and so on and so forth. Ober's and Thomas tests would also be a good test for this, which the Ober's would be a good test for the, I believe it's for the ITB, and testing for that. And then the Thomas test would be a good test to test for tightness in the rectus femoris and the iliopsoas, which all these can cause imbalances, muscular imbalances. Okay, plantar fasciitis. So this is also very, very common among athletes, especially runners, because of just the constant pressure experienced on the forefoot. And plantar fasciitis is or let's first talk about what this word means. So plantar, which is the bottom aspect of the foot. Fascia, which is a thick connective tissue. It's also called aponeurosis, and we'll discuss further. Itis is inflammation. So we got plantar aspect of the foot, the fascia, and it's inflamed. That's basically what it needs. Plantar fascia, so yeah, it's the aponeurosis originating from the base of the calcaneus. So it actually originates even further up from the Achilles tendon, and it extends all the way down to the metatarsal bones, the heads of the metatarsal bones, of the distally of the phalanges, so all the way up here. Okay, so typically the pain that is associated with plantar fascia, it's typically on the medial portion of the calcaneus, so it's typically right around here on the medial aspect. A lot of people are complaining of, and the pain is often worsened in the mornings or upon returning to activity from a long break. So if someone was sitting down for an extended period of time and got up, they would experience more pain from that. And it is also, the pain is also more felt in foot dorsiflexion, which there's a test that can test for that, which I'll show you. And tight plantar flexors obviously contribute. They don't help the situation. So a good stretching program of these muscles, the gastrocnemius and soleus, would be very important to these athletes. So common causes, as we kind of already discussed, we got weakness. So the reason why plantar fasciitis occurs is because there's a weakness going on in the muscles at the plantar surface of the feet, and that causes a weak arch and overly flat foot or overpronation. And by restoring those muscles, we can help to create that arch again and strengthen those muscles to relieve that tension on the plantar fascia. As you can see here, actually, going back to the previous slide, I have a picture here of minimalist shoes, because there's actually studies that show that by strengthening the plantar surface muscles, it can help to restore and build those muscles to help lengthen the aponeurosis. Okay, so improper footwear, as we talked about, is another common cause, and overtraining or overreaching in one athlete's program would be another cause. And finally, so as to test for this, the most common way is the what's called the windlass test. Hope I'm pronouncing that right. But basically, it can be performed either weight bearing, which, as you can see in this picture here, the patient is either seated or standing, but it's placing pressure on the surfaces of the feet, and the tester is pulling up on the toe, which is causing dorsiflexion, which the dorsiflexion of the metatarsal phalangeal joints during walking creates tightness within the plantar fascia, and that is called the windlass mechanism. So what they're testing here is dorsiflexion to bring about, to see if there's pain associated with that dorsiflexion. And then you can also see in this picture where there is a patient is probably seated or laying down, and it's non-weight bearing. But again, the performer is pushing back on that toe into dorsiflexion to bring about either a positive or negative sign. And that's all I have for you, and I thank you for watching.